Hi, everybody. I'm Dr. Michael Hyman. I'm a practicing urologist in Encino, California. Today, I want to talk about one of the medications that we commonly use for prostate enlargement, a condition also called BPH, which stands for benign prostatic hyperplasia or hypertrophy, which is just a fancy way of saying a big prostate or a dense prostate. And one of the drugs we'll sometimes prescribe is called Finasteride, or its sister drug called dutasteride. The trade names are also called Proscar or Avodart. Now, I'm going to just, as a quick disclaimer, state that I'm not a huge fan of any medication long-term. I feel like if we can, obviate the use of medication, we're better off. So I just want to get that out of the way. Having said that, let me tell you a quick spiel about how this medication, Finasteride or Avodart, works. Basically, there is a pathway, a biochemical pathway in your body that is about how dihydrotestosterone is formed, okay? Or DHT. And the way it works is that the testosterone that's made in your body gets converted to DHT. Okay, and DHT is actually the hormone, the dihydrotestosterone is the active hormone that results in prostate enlargement. It also is what allows you to become sexually active. So to have sexual libido, to have an interest, to have sex drive, and even to have good erections, you really need to have that dihydrotestosterone. So what happens is that if we can block the conversion of testosterone going to dihydrotestosterone and reduce the dihydrotestosterone, it will help shrink the prostate. What I didn't mention before is that when you have that dihydrotestosterone and more of it, your prostate gets bigger and it can get denser and it can cause difficulty urinating. So oftentimes your urologist typically will prescribe this drug to help shrink the prostate because he's basically blocking the formation of the dihydrotestosterone. The problem, of course, is the side effects. As I mentioned, you can lower your sex drive. It can have an impact on your erections. Some of these things can be long-lasting effects even after you stop the drug. So you have to be mindful of that. There are some positives of this drug that some men will use. For example, it can improve hair growth. So as you can imagine, I don't take it. So I personally find that I'm okay not taking it because I'd rather maintain my sex drive and my sexual function. But you can use those drugs to help with hair growth. The way they know all of this is because there actually was a study that showed that men who were born without the enzyme that converts testosterone to dihydrotestosterone basically were sterile. They never got bald and they never got enlarged prostates. And they thought to themselves, the researchers, well, that's interesting. No prostates formed, not having any male pattern baldness, and have no sexual activities, and of course they didn't have children, but they had a genetic deficiency, all these men. It was in a specific tribe in an unusual place, and they realized that they were missing this enzyme, and that's how they decided how to make this drug. But keep in mind that it does have a lot of side effects. All right? Hope that answers any questions people have about these medications, and feel free to check out our website at www.drhyman.net. You can also email our office for an appointment at info@drhyman.net.